The Healthcare Labyrinth Podcast is back for another episode. Join Marc S. Ryan, a veteran health plan and health technology executive, as he explores the world of healthcare.
Welcome, everyone, to this edition of the Healthcare Labyrinth Podcast. My name is Marc Ryan, and thanks to everyone for listening in. I am recording this about 10 days to 2 weeks before this podcast will first air. It is possible that the budget reconciliation bill is passed, or we are still in the middle of a big debate between moderates and conservatives, as well as between the House and the Senate. A good deal of the debate has surrounded the levels of Medicaid and exchange reductions in the bill. At issue are provisions regarding Medicaid provider tax limits, work requirements, and other reductions. The Congressional Budget Office says the initial House and Senate versions would mean between $800 billion and $1 trillion in cuts over a decade to healthcare providers and up to 16 million losing coverage in America. That's when you include the expiration of premium subsidy enhancements and other regulatory changes from the Trump administration. Healthcare cuts may have changed or could change when the bill passes, but the fact remains that the GOP is exercising what I have called a covert or stealth campaign to reduce government programs. GOP lawmakers may not have repealed Obamacare or various Medicaid coverage, but the outcome is the same. So whether the budget reconciliation bill is passed or not, I thought it was important to have a podcast that covers whether there are smarter healthcare cuts that could be made. There are sensible reductions to healthcare costs that could be made, and it could mean much less impact on coverage. We will take 4 breaks and break this podcast up a bit. So let's get right into it before our first break. Let's dive deeper into the problems with the types of budget reconciliation cuts in the bill. The problem with the Republican proposals is that these are clear and deliberate reductions to Medicaid and exchange coverage, as I have indicated. Whether the reduction is centered on work requirements or limitations on provider taxes, it is clear that the changes would stop many from accessing health care and also lead to states contracting coverage. Again, the GOP is being quite stealthy, but nonetheless, Republican lawmakers get to the same place as more explicit coverage termination initiatives would, as they attempted in 2017 when trying to repeal the Affordable Care Act. Recently, some Republicans have argued that putting reductions to Medicare, principally Medicare Advantage overpayments, on the table might be needed, but it amounts to much of the same as well. Taking dollars out of MA would shrink benefits, increase beneficiary costs, and lead to more contraction throughout the country. Here it is harder to argue that people would lose absolute coverage, but it is reasonable to assume that an overarching proposal to remove revenue to plans would definitely have impacts. So in the end, the GOP proposals to cut Medicaid and exchange spending, and even Medicare if that were to occur at some point, ultimately hurts enrollees and those who provide services in the programs. As I noted, the Congressional Budget Office says as many as 16 million would lose coverage from congressional budget proposals hitting Medicaid and the exchanges, the expiration of exchange-enhanced subsidies, and a rule constraining exchange enrollment in the future. But opponents point to the impact on provider revenue as well. The Urban Institute and the Robert Wood Johnson Foundation broke this down, how providers, hospitals, physicians, and drugs would be impacted in each state by the reductions to Medicaid and the exchanges. Over the next decade, the bill would decrease spending by $321 billion to hospitals, $81 billion to physicians, and $191 billion for drugs. Spending on other healthcare services would decline by $205 billion. If the exchange premium tax credits expired as well, spending would decline by an additional $262 billion over 10 years. Hospitals an additional $103 billion, physicians an additional $39 billion cut, and drugs an additional $50 billion cut. Spending on other healthcare services would drop an additional $70 billion. With that introduction, we will take our first break and come back to discuss how there are smarter healthcare cuts if lawmakers and policymakers had set their mind to it. Be right back.
Health plans and insurance are confusing. Our healthcare system is in dire need of reform. Health policy expert Marc Ryan tackles both issues in his book, The Healthcare Labyrinth. It is both a guide to navigating health plans and fixing American health insurance. Marc dives deep into how health plans and the American health insurance system operate. He then outlines a comprehensive reform agenda for the system as a whole, including pricing, emphasizing health and care management, and ensuring affordable access to health coverage in a private delivery model. Marc is a bit of an unconventional Republican in that he believes affordable access is the morally right thing to do, and that it is also fiscally prudent for our nation. Learn more about Marc's book, The Healthcare Labyrinth, at healthcarelabyrinth.com or search at leading bookseller websites. Available in print, ebook, and audiobook forms.
Welcome back, and we hope you're enjoying this episode of the Healthcare Labyrinth Podcast. We are talking about the budget reconciliation bill and whether there are smarter healthcare cuts that can or could have been made in the budget bill, depending on whether the bill is already passed. Again, we're taping this about 10 to 14 days before it first airs. Now, I have little doubt on Urban's and Robert Wood Johnson's math on provider reductions. If you cut $1 trillion out of healthcare over 10 years, it is technically true that it flows through the system down to providers rendering care. The reconciliation bill hurts both people who are currently insured and providers caring for people. But a case can be made that provider cuts are needed to attack the high cost and inflation problem we have in healthcare. High costs are driving premiums and creating a situation where we, employers, the government, and the insured, are priced out of healthcare. And done right, price reform brings inflation down and bends the cost curve. Over time, it could mean a real reduction in prices and costs. Now, yes, this would mean reductions in revenue to providers, but done over a reasonable period of time, as opposed to what is happening in the budget reconciliation bill, it would force provider reform, especially at hospitals. Not all providers are over-reimbursed. For example, the real rates paid to physicians in Medicare have dropped dramatically over the past few decades. This has eroded independent practices. They have been bought up by hospitals and threatened primary care in the U.S. A case can be made that primary docs need a raise. But the hospitals are clearly the biggest culprits. As opposed to the budget reconciliation cuts that do little more than add to the uninsurance rolls and pull revenue from providers, reductions that focus on true price reform are needed. Those cuts could be focused on real cost controls and reforms without touching coverage per se. Hospitals and other providers don't want that because the current system supports inefficiency and continual rate hikes. Further, hospitals have been using the cuts to say rural and critical access hospitals will close because they already have precarious financial health. The truth, though, is the current system overwhelmingly supports the relatively well-heeled urban and big hospitals, not rural or other critical ones. In fact, the system likely creates at least part of these rural and critical hospitals' financial woes. With reform, more could actually be focused on these hospitals. With that, we will take our second break, and when we come back, we will dive into what the price reforms could be. Be right back.
Lilac Software is proud to work with the Healthcare Labyrinth website to educate people on the healthcare system. At Lilac, we believe transparency is so important in healthcare. The healthcare system is opaque, and Lilac is trying to bring clarity to data and unleash the best member care, reduce costs, and improve outcomes. Our cloud-native payer platform revolutionizes data insights and analytics. Plans have all the data they need, but in silos locked away in point solutions. At Lilac, we solve the data fragmentation problem and help plans turn complex data into actionable insights, leading to greater operating leverage, tight cost controls, and healthier members. Health plans can improve STAR scores, reduce medical expense, drive revenue, and more. Quite simply, with Lilac, you can drive better business and health outcomes. Learn more at lilacsoftware.com.
Welcome back, and we hope you are enjoying this episode of the Healthcare Labyrinth Podcast. We are talking about the budget reconciliation bill and if there are smarter healthcare reductions that can or could be adopted. Before the break, I made the case that price reform could reduce the cost of healthcare in the system by forcing reform within the provider system. The following price reforms could be phased in over time and have a meaningful impact on overall healthcare reform. Further, the reforms would also save in the employer world as commercial prices are very much set based on Medicare rates. Budget savings are easily in the hundreds of billions when fully implemented, with more savings accrued throughout the whole healthcare system. So, the first provider reform that I wanted to talk about is site neutral payments. It is high time for site neutral payments to be adopted. I wrote a very in-depth blog at healthcarelabyrinth.com on July 8th, 2024. I'd recommend you go look at that if you want more information. It gives you all the details on site neutral payments, what they are, and why adoption is important. There is no reason that hospital-owned settings outside of inpatient should be paid more for the same services provided at independent freestanding facilities or a physician's office. What's more, about half of all doctors are now owned by a hospital or health system, and physician practice patterns are changing. Hospital employers are now telling their physician employees to practice at more expensive owned settings. This is a huge drain on our healthcare system, serves as a disincentive for hospitals to be more efficient, drives up Medicare and commercial coverage costs, and increases member out-of-pocket expenses. I believe that full site neutrality should be adopted, but various forms save between $5 billion to $145 billion in the Medicare program over 10 years. Again, this could serve as a phase-in. What's more important to underscore is the savings in the commercial world. Prices there are substantially piggybacked off of Medicare. The Blue Cross and Blue Shield Association says healthcare savings between Medicare and Medicaid, as well as consumer out-of-pocket costs, would be $495 billion over 10 years. Related forms here would also include the following. I favor the use of the right site of care in all cases, reining in aberrant physician and other provider patterns, eliminating the Medicare inpatient only list, instituting ambulatory service center procedure expansion, and barring telehealth and facility fees. The next area I'll talk about in provider rate reform is 340B drug price reform. Reforming this drug discount program may not save major government spending, but reforms would reduce costs to employers and beneficiaries. There is growing evidence that hospitals and other entities have abused the program, obtaining deep discounts but not passing them on to the needy and those who can benefit. Studies show prices as high or higher than those entities that do not receive such discounts. These prices then roll out across Medicare and commercial and increase out-of-pocket costs. Here are some other proposals or ways of reducing provider pricing. They include barring all or nothing contracting. This drives rates and costs, requiring hospital administrative cost reporting and limiting such expenses. Health plans have implicit caps in place, and so should providers. Provider admin costs are out of control and rising. Reforming the Pro-Provider No Surprises Act. Arbitration decisions are favoring the huge prices providers set, and these awards are driving up overall costs. And last, expanding price transparency and enforcement in both the health plan and the hospital world. With that, we will take our third break, and when we come back, we will discuss drug price reform and Medicare Advantage overpayments. Be right back.
The Healthcare Labyrinth is no ordinary website. It features news and commentary from one of the nation's leading healthcare policy and technology experts. Marc Ryan combs the internet for the latest healthcare news and publishes a news feed each weekday with summations and Marc's insights. Twice a week, Marc publishes a blog to go deep into a current issue. And of course, Marc hosts a podcast each week to delve even further. All of this is available at healthcarelabyrinth.com. Visit each day for the latest happenings in healthcare. As well, learn more about Marc's book, The Healthcare Labyrinth, at the website. That's healthcarelabyrinth.com, your go-to source for healthcare news.
Welcome back, and we hope you are enjoying this edition of the Healthcare Labyrinth Podcast. We are talking about the budget reconciliation bill and smarter healthcare cuts that could be implemented. We're now going to cover drug price reform and Medicare Advantage overpayments. Proposals on drug price reform could save considerably as well. President Trump has proposed most favored nation pricing across the entire healthcare system. Currently, Americans pay many folds more than those in other developed countries. His proposals to overhaul the transparency of and how the drug channel operates are key too. Both the President and Congress want to reform pharmacy benefits managers and ensure vertically integrated PBMs are not using sister companies to inflate margins at the expense of consumers. It is safe to say that all these reforms could save several $100 billion on our $800 billion drug bill annually across retail, specialty, and medical drugs. Let's quickly talk about Medicare Advantage overpayments. While I back MA's importance to the future of Medicare, there also are changes that can be made here to rein in unreasonable costs. While I said this could be problematic earlier in the podcast, phasing in changes would help lessen the impact to benefits and cost to beneficiaries. The area that makes the most sense to tackle is risk adjustment reform. Related just to risk adjustment, not all overpayments, there are varying estimates of savings. Congressional policy arm MedPAC says $43 billion annually could be saved. University of San Diego researchers say $34 billion annually could be saved. The Centers for Medicare and Medicaid Services says $17 billion could be saved each year. Based on several studies and audits I have seen, I peg that number between $10 billion and $17 billion annually. CMS has already gone down this road by implementing a new risk model, V28, which appears to take over 7% out of rates and is focused on removing the propensity for overpayments. It also has announced a 100% risk adjustment data validation audit process, although I have some concerns with some proposals. Budgeteers could book savings in these two areas. I have backed some other reforms properly phased in. These include barring coding tied only to manual chart reviews, barring coding tied only to health risk assessments, applying the coding intensity factor on a plan-by-plan basis to take into account each plan's relative coding intensity, with a credible adjustment for real differences in risk based on population demographics. With that, we will take our last break, and when we come back, I will offer some final thoughts. Be right back.
Lilac Software is proud to work with the Healthcare Labyrinth website to educate people on the healthcare system. At Lilac, we believe transparency is so important in healthcare. The healthcare system is opaque, and Lilac is trying to bring clarity to data and unleash the best member care, reduce costs, and improve outcomes. Our cloud-native payer platform revolutionizes data insights and analytics. Plans have all the data they need, but in silos locked away in point solutions. At Lilac, we solve the data fragmentation problem and help plans turn complex data into actionable insights, leading to greater operating leverage, tight cost controls, and healthier members. Health plans can improve STAR scores, reduce medical expense, drive revenue, and more. Quite simply, with Lilac, you can drive better business and health outcomes. Learn more at lilacsoftware.com.
Welcome back, and we hope you are enjoying this edition of the Healthcare Labyrinth Podcast. We are talking about the budget bill and smarter healthcare cuts that could be implemented. So here's a few concluding thoughts for me. Now, I am not so Pollyannish to assume there is no coverage fallout or impact on providers' financial health from my provider rate reform proposals. But again, done in a sober and phased way, the healthcare system could be transformed to the benefit of plans, providers, employers, and consumers. It is far superior to how each party thinks about it. The GOP's chopping at coverage and the Democrats' fixation with driving more and more coverage and benefits without a thought to efficiency of the system at all. With that, we will conclude this edition of the Healthcare Labyrinth Podcast, and we'll see you next week. Take care.
Thanks for joining Mark and the Healthcare Labyrinth Podcast. Go to healthcarelabyrinth.com each day for the latest healthcare news. See you next week on the next Healthcare Labyrinth Podcast.